There is a convergent evidence base demonstrating the role of the anterior temporal lobe, or ATL, in language processing, and more specifically in semantic memory. Evidence from a number of patient groups, complemented by TMS and functional imaging studies in healthy controls, has led to the proposal of a transmodal representational hub located bilaterally in the ATLs, in which sensory, motor, and verbal experiences converge to enable the formation of coherent concepts. Semantic memory is central to our ability to both comprehend and express knowledge across verbal and nonverbal domains, with disruption to semantic memory significantly impacting upon patients' daily lives. But for refractory or medication-resistant temporal lobe epilepsy, or TLE, unilateral anterior temporal lobectomy is the primary surgical treatment, with invasive ATL resection effectively alleviating seizure activity in up to 90% of cases. Given the convergent evidence base demonstrating the role of this region in semantic memory, it would follow then that anterior temporal lobectomy may cause deficits in this area. However, TLE patients who undergo surgical resection do not usually exhibit or report significant language deficits. In fact, clinical presentation post-surgical resection of the ATL is often cited as evidence that the region has little role to play in semantic memory, as when using standard clinical assessment methods such as naming or fluency tests, these patients do not present with measurable semantic impairment. However, this contrasts with the previously mentioned evidence from TMS and functional imaging studies in healthy controls, and it also undermines the description of semantic impairment documented as a result of various other etiologies with differential involvement of the anterior temporal region. This includes semantic dementia, HSBE, and CVA. This inference is premature, however, given the chronicity of repeated focal epileptic discharges in TLE may result in plasticity-related reorganization of function to occur prior to resection. And also studies have shown that if semantics is probed more thoroughly, then a subtle impairment is in fact found. The proposal that the chronicity of recurrent focal epileptic discharges allows time for functional reorganization is supported by several findings. Firstly, post-surgical deficits seen in patients with a later age of seizure onset tend to be more severe. Also, studies have found neuroanatomical differences in patients with chronic epilepsy. These include significant alterations to neurotransmitter function and also to connectivity of language-related white matter pathways. Such neuroanatomical changes should suggest the shifting of language function away from the seizure-affected region, with subsequent less severe consequences resulting from surgical resection than would otherwise be expected. Unfortunately, as the majority of studies to date have only assessed language ability in patients post-surgically, investigation into the possible contribution of these pre-surgical factors has been limited. Also, studies have largely focused on isolated areas of language and cognition, so for example, semantics, or used solitary tasks to assess language, for example, just a naming task, rather than comprehensively assessing language as a whole. There has also been limited consideration of the differential language profiles that may arise due to lateralization or localization of epileptogenic focus. Clinically, there is also a need for improved clinical protocols for the assessment of patients with epilepsy, and particularly for more reliable pre-surgical language mapping paradigms. A systematic and comprehensive assessment of language skills is warranted both pre- and post-surgically to ascertain the extent of impairment and the impact of surgery on residual language systems. As such, the aim of this project was to systematically investigate and characterize for the first time language processing in patients with epilepsy. This will be done through the use of a comprehensive language battery. And from this, we hope to develop a clinically useful language battery, one which we can identify components of the battery which are most informative for different epileptic etiologies, and also better understand the role of the ATL. We hypothesize that by utilizing a more systematic and comprehensive assessment battery, it will be revealed that language in people with epilepsy does differ from that of the general population. We also expect that different components of the assessment battery will be informative for different epileptic etiologies, and that there will be different patterns of language performance based on epileptogenic foci. To investigate this, performance on a range of language and cognitive tasks will be analysed and compared with normative data through use of a prospective cohort study design. Subsequent analyses will be used to compare participants based on epileptic foci to determine whether language profiles do differ as a result of epileptic etiology. Further analyses will include investigation of potential compounds and relationships of interest. So this includes, for example, seizure onset, seizure frequency, and medication use. In terms of the assessment battery, it will include assessments routinely used in the management of people with acquired cognitive and communication disorders. So for example, the CAT, in addition to assessments previously reported to be sensitive to deficits in epilepsy patients. So this includes synonym judgment tasks and narrative assessments. Relevant clinical investigations, medical history will also be collected, which are part of the standard pre-surgical workup. This research project will systematically describe and characterise for the first time the language profile of patients with epilepsy. It will also lead to the development of a clinically useful language battery for assessing language in epilepsy patients and identify components of this battery that are most informative for those different epileptic etiologies. As previously mentioned, it will also contribute to a greater understanding of the role of the ATL and its contribution to language processing and more specifically semantic memory. Understanding the impact of chronic seizures on the brain and on language could result in advances in treatment for people with epilepsy, both pre and post-surgically, clearer information for them and their families, and result in overall improved patient outcomes. Minimizing the long-term impact and burden of language deficits will have social, economic, and psychological benefits for the patient and their family, and will also reduce the longer-term burden on the healthcare system. Whilst this project is primarily concerned with profiling language in epilepsy patients, it will have broader implications across other patient cohorts in which language representation in the brain is impacted, particularly those which sometimes require neurosurgery. So, for example, brain tumor or vascular malformation. These findings will also lead to further research, specifically the investigation of language function at a neural level and the optimization of pre-surgical language mapping protocols. This is actually what I hope to work on in the second stage of my PhD, as clinically there is a strong need for improved clinical protocols for the assessment of patients with epilepsy and for more reliable pre-surgical language mapping paradigms. Thank you very much for your time today. And if you have any questions or you're interested to hear more, please feel free to get in contact with me. I would love to hear from you. Thank you.